Good afternoon, I'm William Prince, and today I would like to talk about the mental health impact on nursing among this COVID-19 pandemic. The first thing I would like you to do is take a moment to imagine one of your worst work days. You're nurses, you work in an ICU, you've had several admits on this day of people in acute distress. One individual died, passed away on a ventilator. You had to interact with this individual's family. You had to prevent this individual's family from being in the same room as the individual that died on a ventilator. During the course of your workday, there were a couple times that you fear you didn't take full precaution for your own self. And your mother lives with you at home. You have a family. The last thing you want is to bring COVID-19 home with you. As you're about to leave towards the end of the shift, exhausted, your supervisor comes up to you and says to you, "I'm really sorry, but we had another call in. Can you please work a double shift for us again?" This is the second or third double shift that you've had this week. How do you feel? Maybe the important question is, do you know how you feel? So I'm going to talk a little about the COVID-19 pandemic, its impact on society, and thus its impact on nursing health professionals. I'm going to talk about the mental health risks and some possible solutions to developing mental health issues related to this additional stress. Then we'll talk a little bit about barriers that make it difficult to have solutions. So first off, as far as society is concerned, we know that over 300,000 individuals have died from COVID-19 as of now. And we're in the middle at this moment of another 3-week shutdown in Southern California. I saw on the news earlier that certain hospitals have had to get more freezer trucks because there isn't any room for the bodies of those who have passed away from this. Right now, there's less ICU beds available in Los Angeles County. Last I saw, 2 to 3% availability of an ICU bed or space. I was in the elevator in my condo complex the other day, and I overheard someone whom I've never met in scrubs talking about how they ran out of ICU beds and about what the day he was having. So this is very real. For nurses, they're working double shifts. They're working without enough protective equipment. They're working without other resources that are needed to help keep people alive. And there's less treatments that do help people when they get really sick. There's vaccines coming, but we're still months away. There's still a big issue going on right now. But one of the main issues that nurses are having to face is an inability to fulfill the interpersonal functions of their jobs. They're having difficulty doing what they've been trained to do to help comfort and aid individuals because of safety protocols. They have to keep their distance. This is challenging for a nurse, as most people get in the health professions because they want to help others. They don't like seeing people in pain, but they're seeing a lot of people in pain now. The other part of this is getting support from others. It's very common for people to work in teams and to rely upon each other and to be able to fall back on each other when they're having a difficult time. But are they even able to get that kind of support? Or is it much more distant? So Polak and colleagues identified depression, anxiety, and insomnia as being mental health issues in which nursing staff are going to be at increased risk and are at increased risk during this COVID-19 pandemic. Clancy and colleagues discussed acute stress disorder and post-traumatic stress disorder and the increased risk due to added traumas and stressors, including recurring stressors of similar themes without the ability to help, which is another thing which I'm going to talk about, which has to do with moral distress. Now, moral distress is a term Owens talks about in his 2020 study that has to do with the inability to do what you know is morally right due to certain protocols and safety issues. It's what I talked about when you are not able to do the intervention that you know is the right thing to do, that you've done so many times, but everybody has to keep their distance now. You can't let a family be with the person who's passing away because you can't put them at risk. That just is one example. So what are some of the things that we can do? Well, most people have had training that has to do with self-care. They had it early on in a nursing program and are still doing it. These are things that in general can assist in helping increase resiliency factors. It means eating properly, sleeping properly, getting exercise, having balance in your life. It has to do with the ability of a nurse to take her own pulse and know that something isn't right now. And you need to do something to get yourself right, that's healthy, that's good for you, so that you can help others. Some people are going to need professional services from a psychologist such as me. Different interventions, psychotherapy can help reduce the intensity of different mental health illnesses, can help remit things early on if it's addressed at the right time, and it may be needed. Some people may even need pharmacological intervention. That's not a problem. It's just another illness. You treat people with illnesses. If you have one, please get the help that you need. One of the things that's important that doesn't have to do with your own self-care, is organizational supports. According to Pollack, organizations do not fully understand what the mental health needs are of nurses, and they need to know. The other thing is, nurses often minimize what they need because they're so focused on helping others. They don't stop and take their own pulse. It's possible that some different things can help. For one, if you were to use additional PPE that's available and safely be able to have family members see somebody who is going to pass away without touching them, but at least closer, safely, that can reduce the stress a nurse may feel, that moral distress we were talking about. There's other systemic things that need to be done. Some studies have looked at actually having some first aid available, although research as of yet doesn't show conclusively that it helps, and that's according to Pollack. So, in conclusion, the risks of mental illness are greatly increased among the COVID-19 pandemic. There are many factors that increase these risks, and nurses are at increased risk of developing different mental health disorders. There are different things a nurse can do. More information is needed in order to find the best interventions, but we need to start. And we need to take a look at the barriers that are getting in the way. Thank you very much for your time. Thank you for listening, and have a great day.